Hello everyone, I'm Anas Al-Ubaidi, and the topic for this session is OB GYN Scribe Certification Exam within Chapter 27, which is about review of OB GYN scribing within the Certified Medical Administrative Assistant course program by ACMSO. Introduction. The OB/GYN Scribe Certification exam is a significant milestone for individuals aspiring to excel in medical scribing within the specialized fields of obstetrics and gynecology. This examination serves as a benchmark to validate the advanced skills and knowledge required to function effectively in OB/GYN settings. By obtaining this certification, scribes demonstrate proficiency in capturing complex medical documentation, ensuring compliance with industry standards, and supporting healthcare providers in delivering high-quality, patient-centered care. Certification signals to employers and colleagues that a scribe possesses the advanced competencies necessary to meet the unique demands of women's healthcare environments. OB/GYN medical documentation is among the most intricate in medicine as it encompasses a wide range of patient encounters. From routine gynecological checkups to high risk pregnancy management, scribes are tasked with accurately recording sensitive, dynamic, and often critical details. The certification exam reflects this complexity, assessing candidates' abilities in areas such as effective patient communication, detailed documentation of antenatal and gynecological visits, and comprehension of key OB/GYN procedures. For instance, scribes must meticulously document contraceptive counseling, abnormal pap smear follow-ups, pregnancy progression, or emergent conditions such as ectopic pregnancies. Failing to capture precise information in these situations can compromise patient care, making the skills tested in the exam indispensable. Another critical aspect Another critical aspect of the OB/GYN scribe certification exam is testing knowledge of documentation standards, including the SOAP format, ICD-10, and CPT coding, and adherence to legal and ethical requirements such as HIPAA compliance. Candidates are expected to demonstrate not only an understanding of these frameworks but also their application in specialized OB/GYN contexts. Examples include coding for procedures hyper like hysteroscopies or cesarean deliveries, documenting subjective complaints such as pelvic pain within the SOAP structure, or ensuring privacy in cases involving sexual health discussions. Mastering these skills not only enhances workplace efficiency but also safeguards patient information and upholds professional integrity. Certification also emphasizes the application of medical scribing skills within multidisciplinary environments. The hallmark of OB/GYN practice, obstetrician gynecologists collaborate with specialists such as maternal fetal medicine providers, reproductive endocrinologists, oncologists, and neonatologists. For scribes, maintaining accurate and accessible documentation ensures a clear communication across these teams. The exam evaluates how well scribes can handle this collaborative aspect, focusing on their abilities to coordinate information from varied sources, contribute to decision-making workflows, and document consultations and care plans seamlessly. Beyond technical competence, the OB/GYN scribe certification exam highlights the role of scribes in fostering meaningful patient interactions. Communication in OB/GYN settings often involves sensitive topics, from sexual history and fertility issues to miscarriage or cancer diagnoses. Scribes must balance empathy and professionalism, documenting these discussions with respect and precision. The exam verifies that candidates are capable of managing these unique dynamics, handling sensitive data, and supporting healthcare providers in creating a safe, supportive environment for patients. For students preparing for this milestone, success on the certification exam represents more than a qualification, it is a gateway to advanced career opportunities and professional development. Certified OB/GYN scribes are in high demand, particularly as healthcare systems prioritize accurate documentation and streamlined workflows. Key points. Mastering patient communication. Effective patient communication is a critical component of OB/GYN Scribe certification exam. It ensures scribes capture accurate patient data while maintaining empathy and professionalism. Engaging in active listening. Definition: active listening involves understanding what the patient shares verbally and interpreting emotional and nonverbal cues. Example: during a prenatal or antenatal visit, a patient may express anxiety about labor. Proper documentation would include patient states she is worried about pain management during delivery. Relevance: accurate reflections of patient concerns allow providers to offer targeted, patient centered care. And here is a summarized diagram on breaking down active listening in healthcare. Handling sensitive topics. Key elements discussions may include sexual history, contraceptive usage, or miscarriage experiences. Example: documenting patient indicates challenges adhering to oral contraceptive schedule due to side effects. Importance: builds trust, enabling patients to share complete and honest information, which is vital for their care. Maintaining neutrality and empathy. Practice here: avoid judgmental language, focus on factual, non emotive documentation. Example: instead of patient denies pain despite appearing uncomfortable, use patient states no pain but shifts positions frequently. The outcome here encourages better patient scribe provider dynamics and supports clear clinical decision making. And here is a summarized diagram summarizing or reflecting the navigating sensitive health discussions. Documentation standards, consistency, and adherence to OB/GYN documentation protocols are essential for accurate and efficient charting. As SOAP format application here, structure organizes notes as subjective, objective assessment plan. Example: subjective, complaints of lower abdominal pain. Objective, this is subjective, this was subjective. Objective, a PE reveals uterine tenderness, ultrasound pending. Assessment: suspected ovarian mass, a planned schedule, gynecological oncology. Referral. Advantage here offers a logical, easy to follow format for providers at all levels. ICD-10 and CPT code proficiency purpose here: properly classify medical diagnoses and procedures for billing and legal accuracy. Example: ICD-10 code 014.2 severe preeclampsia, CPT code 76820 fetal Doppler image. Impact: avoids reimbursement delays, ensures robust medical legal documentation. Timeliness or timeliness. Best practice here: documentation should happen in real time or immediately post visit. Example: ultrasound ordered at 9 a.m., reviewed and updated at 9:30 a.m., 30 minutes after. Outcome: promotes accurate, defensible documentation with seamless care transitions. Understanding OB/GYN procedures. Knowledge of common OB/GYN procedures is crucial for ensuring complete documentation during provider encounters. Routine visits. Detailed scribes document menstrual cycle history, contraceptive use, and findings from pap smears or STI screenings. Example: patient reports regular cycles, LMP 21 days ago, sexual active, using condoms occasionally. Significance here: provides a baseline for identifying potential gynecological issues. Obstetrical documentation components includes prenatal, antenatal visits, monitoring fetal growth, or managing pregnancy conditions. Example: baby in cephalic position at 36 weeks gestation, HR heart rate 140 BPM beats per minute. Relevance: ensures comprehensive records for routine and high-risk pregnancies. Surgical and diagnostic interventions procedures here document hysteroscopies, colposcopies, cesarean deliveries, and biopsies. Example: endometrial biopsy performed under local anesthesia, specimen sent to pathology. Impact: maintains continuity of care and supports provider teams in making informed decisions. Handling sensitive information. Managing sensitive patient data requires strict adherence to ethical, legal, and professional standards. HIPAA compliance practice Here, secure patient records ensure they are accessible only to authorized personnel and avoid unnecessary data sharing. Example, sensitive records regarding infertility treatments logged for OB team access only. Outcome fosters patient trust and protects practice integrity. Respectful and inclusive documentation approach here avoid discriminatory or subjective language. Example, use patient states past experience of gender dysphoria may pose barriers to routine pelvic exams instead of biased terminology. Benefit ensures inclusivity, providing equitable care for diverse patient populations. Addressing legal obligations mandate here document incidents of abuse, neglect, or derangement and follow legal reporting requirements. Example, patient reports intimate partner violence, referral initiated to social services, mandatory reporting completed. Significance safeguards patients while adhering to legal obligations. Strategies for success on the exam. Practicing case scenarios. Regular role playing helps improve documentation speed and accuracy. Interrogate cases such as emergency cesarean sections, demand precision, and adaptability. Reviewing OB/GYN terminology, familiarity with terms like nulliparous, salpingectomy, or macrosomia ensures proper usage in diverse scenarios during examinations. Utilizing resources, leverage study guides and practice tests, focusing on topics like coding, HIPAA compliance, and HIPAA applies to USA as there are similar to HIPAA in every geographical area or country or continent. For instance, in the European Union, in EU, we have GDPR and SOAP or SOAP note structure. Summary tables, table on key elements of patient communication on OB/GYN, communication aspect, description, example, importance, risk of neglect. Communication aspects, we have active listening, handling sensitive topics, empathy and neutrality, use of simple language, and cultural sensitivity. Table and core documentation standards for OB/GYN, scribes, standard description, example, benefit, risk if ignored. Standards, we have SOAP note framework, ICD-10 and CPT coding, timeliness and recording, comprehensive details, data privacy, and HIPAA. Table on understanding common OB/GYN procedures, procedure, description, example, relevance, failure, impact. Procedures, we have pap smears, prenatal or antenatal visits, colposcopy, hysteroscopy, delivery types. Table on key points in handling sensitive patient information. Sensitive aspect, description, example, importance, risk if ignored. Sensitive aspects, we have confidentiality standards, empathy in documentation, abuse reporting, consistency in accuracy, and inclusive language. Table on multidisciplinary care coordination for OB/GYN cases, scenario, care teams collaborated, example, documentation role, positive impact. Scenarios, we have high-risk pregnancies, oncology consultations, fertility treatment case, and ICU prepared deliveries, postpartum assessments. Next, we will revise what we have covered through this lecture via some multiple choice questions or MCQs. Question 1. Which of the following represent the purpose of SOAP format in OB/GYN documentation? A. To classify patients' insurance coverage. B. To provide standardized structure for detailed medical notes. C. To summarize treatment goals without diagnostic specifics. Or D. To document procedures without subjective complaints. The answer is B, definitely, to provide a standardized structure for detailed medical notes, as the SOAP format, subjective objective assessment and plan, ensures that patient data is recorded in a logical and systematic manner, which is essential for clarity and continuity of care in OB/GYN cases. Question 2. What is the best practice for ensuring compliance with HIPAA regulations in OB/GYN scribing? A. Sharing patient data openly among all clinical staff. B. Securing access and limiting recourse to authorized OB/GYN team members. C. Storing patient data without encryption to expedite file retrieval. Or D. Avoiding documentation of legal cases involving abuse. Answer would be B. Securing access and limiting records to authorized OB/GYN team members, as protecting patient data by restricting access and maintaining encryption ensures HIPAA compliance and builds trust by safeguarding sensitive medical records. Question 3. Which scenario demonstrate demonstrates accurate documentation of antenatal or prenatal care. A. Patient complains of fatigue, no documentation of fetal growth provided. B. Heartbeat documented as 140 beats per minute, fetal position cephalic, patient at 32 weeks gestational age. C. Patient's medical history noted, no mention of prior pregnancies included. Or D. Unconcluded appointment without finalizing care progression notes. Answer would be B, as effective prenatal documentation includes fetal health metrics, gestational age, and relevant dates during each visit, ensuring comprehensive tracking of maternal and fetal well-being. Question 4. What is the primary responsibility of an OB/GYN scribe when documenting a sensitive patient encounter such as reporting abuse? A. Avoid documenting such incidents to minimize conflict. Use vague language to generalize the extent of abuse. C. Clearly document details reported by the patient and initiate referrals as required. Or D. Decide the legal outcome on behalf of the patient. Answer is C. Clearly document details reported by the patient and initiate referrals as required. As scribes must ensure that specific details regarding sensitive cases like abuse are documented accurately and reported to the appropriate authorities, aligning with legal and ethical obligations. Question 5. What is critical for a scribe to accurately document during an OB/GYN procedure such as a cesarean delivery? A. Record ideal conversations among staff in the operating room. Um, B. Note specific details like indication for surgery, incision type, and delivery of fetus. C. Briefly mention the procedure but exclude related observations. Or D. Document patient complaints without including surgical outcomes. Definitely here the most suitable answer is B, to note specific details, as proper documentation of surgical details ensures legal compliance, supports continuity of care, and creates a reliable medical record of postoperative evaluations. And here we come to the end of this lecture. Thank you very much and goodbye.